Hello everyone. Thank you very much for joining me today for my project's presentation. My name is Jorge Zapata. I'm a Marie Curie PhD Fellow in Health Cascade, and I'm based in Barcelona, Spain, in Blanquerna Ramon Llull University. I'm part of the Health, Physical Activity, and Sport Research Group, and my background is in architecture and urban planning. My PhD project is called Engage for Change, engaging care home residents and community dwelling older adults in the co-creation of healthy urban spaces to promote physical activity and reduce loneliness. Let's start by understanding the rationale behind this project. From the literature, we know that older adults, especially care home residents, are the least active and most sedentary segment of the population and are more likely to be isolated and experience loneliness. We also know that people 65 years of age or over present more difficulties accessing spaces to engage in physical activity and social interaction. Inclusive urban spaces are essential for achieving age-friendly cities. We also have to acknowledge the right to the city. Urban spaces should be inclusive, democratic, and accessible to all residents. And this is far from being the case in many cities. Older adults and all other vulnerable groups tend to be left out of urban transformation processes. Lastly, we also know that high levels of physical activity have positive effects on the physical, social, and emotional dimensions of the older adult population. So I'm taking all this background knowledge and proposing the use of co-creation as an overarching approach to position end users, namely older adults, and key stakeholders as decision-making agents in an urban design project in Barcelona, Spain. What are the aims of Engage for Change? So first, we aim to document the distribution of care homes in Barcelona and to classify the built environment used by the older adult population in La Champla, which is a specific district in the city that I'm going to explain with a little bit more detail later in the presentation. So we want to understand where do older adults live? What spaces do they use in their daily routines? How far do they move from their place of residence? Second, we want to analyze the co-creators' movement behavior in their daily routines, level of loneliness, and social interaction. So we want to understand how much physical activity they engage with, how often do they see friends or relatives, and how lonely do they feel. Third, we aim to collectively design and present a proposal for an urban space incorporating a health and active aging perspective. So we're gonna actually design a specific space, and that can be a plaza, a street, or another urban space proposal that reflects the needs of the co-creators and represent an example of an urban space taking into consideration the needs of older adults in this specific neighborhood. And lastly, we want to evaluate participants' feeling of ownership within the co-creation process. We want to understand how engaged the participants were in this process and if co-creation was helpful to streamline this urban design project with the participants from the beginning. What are the methods that we are using in Engage for Change? So first, we are focusing on the older adult population, 65 years of age or more, in the Guetta de la Champla neighborhood in Barcelona. Our co-creators will consist of two groups of 10 older adults, residents from one care home and community dwellers. We also account with three relatives to health professionals, care home staff members, researchers, and urban planning professionals. This project has a duration of 2 years, divided in three phases: an exploratory stage, needs assessment, and co-creation core, with a transversal process evaluation. Lastly, we are using a variety of methods and activities to streamline this co-creation process. All this translates into a study design that starts by understanding the context, going through some interviews with key professionals to understand their perspective on the needs of the older adult population, selecting specific care homes and residents to work with, and jump into a needs assessment stage in which we understand the levels of social interaction and loneliness, as well as physical activity and sedentary behavior of our co-creators. We conduct some collective mapping, photo voice exercises, and community walk audits to document their public space use, and finally, we conduct a co-creation core stage in which we produce our collective design. Now let's jump into the context. This is a map that I produced in the first stage of this study to understand especially the distribution of care homes and other facilities for older adults in the city of Barcelona. It was very evident from making this map that the highest concentration of care homes and facilities for older adults was located in La Champla district, which is the area highlighted by the green dashed line. More specifically, there was a higher concentration in one neighborhood within this district, which is called Dreta de la Champla and is the area highlighted by the green color in the center of the district. And you will wonder, do all older adults live in care homes? I also consulted public data to see where do people over 65 years of age live in the city of Barcelona. And actually, 17% of the total of the older adult population live in La Champla district. So this makes a perfect case to focus our study in the Greta de la Champla and propose an urban design project with the use of co-creation in this area. I wanted to go one step further and analyze the availability of public green spaces in the city level to understand how that affects the specific area that we selected. This map shows how far do an older adult have to walk from their place of residence to reach a public green space. Usually these maps are done taking into consideration a travel speed of 4 km per hour, which is the walking average speed of an adult, but this map is made taking into consideration half of that speed, which according to the literature will be the average speed for children under 5 and older adults over 75. This map shows that in most of the Greta de la Champla neighborhood, you will have to walk more than 15 minutes to reach a public green space. I also consulted data on social interaction and found out that older adults in the Champla district, 58.7% never attend group activities and only 18.6% reported to attend such activities several times a week. Is this related to the lack of public space areas? It is not clear, but certainly more spaces to interact could encourage people to engage more with others and also to do physical activity. Having our co-creation group consolidated, we started by understanding their public space priorities, and we conducted an exercise in which we asked them to arrange some priorities according to their needs, and interestingly, the group showed two main subgroups. The people that only use walkers or that have more autonomy um, prioritize the conditions of the sidewalks, streets and pedestrian crossings, and the sense of safety and security over all the other elements, whereas the people that have less autonomy or use wheelchairs, prioritize the ease of access, presence of ramps and public transport, and also the proximity to their place of residence. And this helped me to understand that even though we are working with a specific target group, such as older adults, we cannot put all the older adults in the same basket. They will prioritize different things just because all of them are individuals, but also because all of them have different movement restrictions, and that is going to affect how they see and how they interact with public space. We wanted to contrast the self-reported data with objective data, so we conducted a GPS study in which we handed in devices to our co-creators during 7 days a week to document the exact places that they use and the distance that they travel within that week. And one of the main takeaways of this study was to understand that they wouldn't go to a public space that is farther than 10 minutes walking from their place of residence. 10 minutes, which considering their travel speed, means 350 meters, so 3 blocks of the city on average. Then we zoom in into the neighborhood level to understand what was the actual public space network in the area. And in this map, you can see a bunch of gardens, plazas, and squares. But after going to each of those physically, we encounter several barriers, such as lack of signage, of some of the spaces were closed, among other things. So we decided to select a group of these spaces representing 5 different typologies of available public space to go and check out with our co-creators and document those barriers using a community walk audit tool. The spaces that we selected were these 5: 2 mid-block plazas, 1 main square in the neighborhood level, a green corridor, and a path that crosses a block that was transformed into a park. These are some pictures from the community walk audit, and as you can see, most of the users had wheelchairs, so we accounted with several researchers that help us um, pull the wheelchairs and document the elements that the co-creators will highlight along the walk. We stopped in each of the spaces and documented several themes such as access, attractiveness of the place, barriers, maintenance, among other topics. Then we decided that it was interesting not only to document the perception of the users of these given spaces, but to analyze the determinants of health in public space using a specific tool to assess these determinants. And we divided the group of care home residents into 2 subgroups to facilitate the use of this tool, and we also invited the 4 researchers that help us in the community walk audit and an external researcher that wasn't involved with the community walk to also complete the tool and compare how researchers and the co-creators perceive and assess this space using the tool developed by the City Council of Barcelona and a research institute called IS Global. It is important to note that our researchers have a variety of backgrounds, so they are not representing only one field but several, like physical activity and sports, implementation and evaluation of co-creation, and also architecture and urbanism. It was very interesting to see how different is the perception of the researchers and their approach when assessing a public space in relation to the co-creators. So the researchers or experts will prioritize objective measures, design features and surroundings, standards for waste disposal, inclusive design, range of activities and programming, social cohesion and aesthetics, and overall value, whereas the co-creators or end users will prioritize subjective experience, personal safety and needs, overall cleanness, so more tangible things that they can see or that they experienced previously in relation to a space. Um, they will be very pragmatic in the sense that if they felt that they were taking into account in the design or transformation of an space, or if they were just left out. And they will think more in the individual level rather than the social implications of a given space. We are also using virtual and augmented reality to avoid abstract thinking in the design process. It is very common that as design professionals, we use technical drawings like floor plans or sections or even renderings that aim to show the space um, in a hyper-realistic way, but these things tend to distract uh, the actual conversation of the design, and it might actually confuse end users. So we are incorporating virtual reality as a way to see the space, how it was before, and how it could be with our design. And we have noticed that older adults can relate more with this type of a strategy rather than a drawing. What are some key takeaways when co-creating healthy urban spaces with older adults? First, take into consideration that recruiting takes a lot of time. You want to involve diverse older adult populations as active partners in the research process from the very beginning or as soon as you can. So, plan for recruiting your groups way in advance from starting the project. Be mindful. Think that older adults may not show much interest in long-term problems. They might not even be here to see the urban space that you're designing. So make it fun and engaging. Make the case for them to be there. Give them the opportunity to interact with each other and just to have a good moment. Plan, plan, and plan. You want to utilize a lot of different methods and activities to keep your co-creators engaged and to get the right information that you need for your project. Remember that in order to create healthy urban spaces, you actually need information on the determinants of health and the needs of these co-creators and other contextual elements that might affect the area. So make sure you choose the appropriate methods for that. And just to mention, in Hell Cascade, we developed a method selector that is an amazing and open source tool that you can use. And for that, check my colleague Daniel Agnello presentation as well. Make sure you collaborate and involve the social network and caregivers of the older adults. They are the ones that know the most about your group of co-creators, and you're gonna want them to be involved in key activities or moments where you can gather information and also engage them in your co-creation process. Lastly, evaluate while doing. Process evaluation is key for a successful co-creation process. You need to gather the necessary information to iterate accordingly and tailor your co-creation process to your target population and objectives. So that's all about my project for now. Thank you very much for listening to my presentation. I encourage you to stay tuned and reach out if you're interested about this project. And I would also encourage you to stay connected with Hell Cascade and check our social media, subscribe to our newsletter, and also to check out the other 14 amazing PhD projects that my colleagues are conducting. Thank you very much. Goodbye.